Hello, everyone. My name is Joe Sapienti, and I'd like to welcome you all to the MDIC Annual Public Forum, where today we're going to be going over the Case for Quality Collaborative Community. With me today, I have Alan Baumel, who is the Program Director for the Advanced Manufacturing Clearinghouse at MDIC. We have Cisco Vicenti, who is the Program Manager for Case for Quality at FDA. We have Catherine Merrill, who is a Program Director at Medtronic. And we have Rob Becker, who is the Senior Director Quality at Edwards Life Sciences. Before we get started, I'd like to do a brief overview of MDIC and who we are. Next slide, please. MDIC was started in 2012 with the idea of bringing the industry together with FDA around bringing forward the regulatory science. And what that means is being able to bring high quality, safe products at an accelerated rate, so access to technology in an accelerated way. The consortium is a public-private partnership. It's one of the first, if not the only, public-private partnership that is focused on advancing medical device regulatory process that benefits patients. So from a high quality, safe and effective and patient outcomes perspective. We are a nonprofit organization, but we also have members. As you can see here, our membership is very diverse. We have industry members, nonprofit, and government membership. Today we have over 64 participating members with 300 and more subject matter experts focused on regulatory science, real-world evidence, quality initiatives, programs that, again, advance the regulatory science. The purpose of MDIC was designed to bring several strategies to support our mission. We make strategic investments in regulatory science, utilizing working groups, which we're going to be talking about some of those working groups today, on key issues that, again, are meaningful to the development of processes and procedures that, again, advance medical devices. You'll see that we have over 70 resources available to download in our digital resource library. That's across all the initiatives and projects within MDIC. We have 20 active groups, entities that are across the various programs and initiatives within MDIC. So one of the things I'd like to do today is spend some time with this Case for Quality, talking about some of those activities. Again, Case for Quality has working groups and programs under the MDIC umbrella. With that, I'd like to now pass it off to Rob Becker, who's going to give an update on the MDIC.
Thank you, Joe. Appreciate the introduction. And I wanted to give everybody an update on the Case for Quality Voluntary Improvement Program. The program has been really initiated the pilot phase in 2017, and it's continued to be a great success in terms of number of facilities, the number of facilities appraised, and also the continued growth in the number of appraisers that ASACA has that are able to do appraisals within the MDDAP. And so the results from those sites continues to be positive. They continue to reaffirm the value of the program and the perspective that companies have in terms of the feedback they're getting. And so it's nice to see that over the 4 years that this has been going, that we continue to reaffirm the value and the unique aspect of this, and the sites that are participating in it value the appraisal feedback and are able to find that it's meaningful and actionable. In addition, we've trained 28 members of staff within FDA, and so that's great to see that as industry members embrace the VIP, we're also seeing adoption of that within FDA, so that there's familiarity and that there's a little more broad knowledge within FDA of what the program's all about. Like many things last year, obviously the pandemic played a principal role, and so I'd say a lot of the year last year was really trying to figure out how to transition from an appraisal that is really meant to be very personal and very person to person and based on kind of that human element in the room, how to transition that to a virtual environment but maintain the integrity of the process. And so we were able to really transition, get a virtual method set up. We had to change really some of the interactions and some of the planning with the sites. But 68 virtual appraisals were conducted last year, and that was essential to keeping the momentum of the pilot going, and also to continue to get more feedback and demonstrate the value. But you can see on the, kind of in the center there, the feedback from the virtual appraisal was positive. And the feedback overall continues to be positive. And the training and the preparation that we undertook to get a site ready for virtual appraisal was well done, effective, and well received. And so it's great to see that we can continue in the short term with the virtual method, with the idea that long term we go back to a more traditional appraisal. But we've also been able to do this for year one appraisals, multi-site appraisals. And then one of the limitations that the teams found is obviously, as you look at time zone gaps around the world, there's really a more narrow window where the appraisal team and a site can be differentiated so that you maintain the effectiveness of the process. Obviously, as you get too far into somebody being off of their core hours, it gets more difficult. And most exciting is that a few weeks ago, on behalf of Case for Quality Collaborative Community, MDIC was able to announce the formal transition from a pilot to a program. And so, that's been a long time coming, but definitely a huge positive step forward towards this becoming a mainstream practice within the industry. And then looking forward, the FDA is working through some internal processes for more formal announcement through the Federal Register. And then we've got working groups that are going to continue to look at the program, make adjustments, and try and look at the future growth. So regulatory benefits, what guidelines we have for reappraisals, how we handle multi-site appraisals within different companies, what we can do for performance measures and what we want to look at from a program. And then also continuing to bridge the gap between the ASACA model terminology and the medical device community. And then the last is that we'll be aligning the structure with the collaborative community so that the governing committee and the VIP program are in sync with the charter for the collaborative community. And so with that, I'd like to pass it over to Cisco Vicente from FDA.
Thank you, Rob. We go on to the next slide. I think one of the things that I want to just take a moment to really discuss, it's something that we always get asked a lot on our side at FDA. It's really what is it that FDA is seeing with the results from VIP? What are you guys doing with the information and the work that's being done by these organizations? So I just wanted to take a quick moment to let people kind of see what we're doing and how we're looking at things. Part of the way the program was developed and envisioned and, the full structure and operation of it being in this kind of collaborative nature is really the ability to enable some of the flexibility. You heard Rob talk about that. We were quickly able to rethink things and kind of stand up the mechanism for doing these in a virtual format to continue to sustain that momentum and add value. But from an agency standpoint, it's the ability to change the dynamic to be more engaged and interactive, right? To look at things from a more holistic storyboard standpoint and see what the progression is at an organization versus a static point in time activity. So the data kind of feeds a trend, right? It kind of shows us progression. It shows us where organizations are moving up. And again, we're not using this to base any type of compliance or enforcement activity, but it helps us identify broader trends in maybe collectively in the industry. And you'll see the impact of some of that in the next slide that the next presentation comes up regarding the kappa pilot. Organizations who've been driving their journey on their own improvement efforts have shown significant value, things that really impact us from an agency standpoint and help us achieve our mission, which is centered around that patient outcomes piece. Reduction in complaints, better product availability, improved product quality, improved yield. The culture, companies have reported culture changes at the organizations. savings, things that translate into direct value for both the organization, but have actually impacted broader in the community, increased hiring, less turnover in staff. Doesn't mean everything goes well, doesn't mean everything is perfect, but that perspective, that history allows us to take those imperfections and those moments when things happen in context and not be as reactive and responsive, right? Things still go wrong, but now we're seeing earlier engagement. There's work being done to identify things earlier and faster, and people are actually collaborating sooner with us to be part of the solution on things. And that's really what I think we were trying to drive with the whole case for quality efforts and the program that we are participating in here with VIP. As Rob mentioned, we still got some work to do on our side to formalize it and set up the right policy guidance around it. But the program is stable, it's up and running, and I thought that was a great step forward in the work being done. And with that, I will now pass it over to Catherine Merrill to actually showcase some of the work they've done with the kappa pilot.
Thank you, Cisco. For those of you who don't know me, I'm a Global Quality Program Director at Medtronic, and also on behalf of MDIC, in the case of the kappa pilot, I am acting as the program chair for that working group. So I wanted to walk you through some of the highlights of what the team has accomplished and where we're headed. So for those of you not familiar with the effort, the Make Kappa Cool workstream was kicked off in response to an industry-wide struggle identified with the current kappa framework. So basically, there are thousands of employees who really love to solve problems but don't necessarily want to have a kappa. So I did want to say that we have a very dedicated and experienced team, and they've really taken on the challenge to leverage those cross-industry best practices to design a risk-based approach to kappa. And our real goal is to shift the focus from a compliance-based activity back to the true intent of kappa, which is problem solving. So with our goal to facilitate continuous improvement, we're really trying to enable organizations to improve faster. And this next column really touches on the team's progress. So we started out this work with an industry-wide survey to identify pain points. We then benchmarked about 10 different non-medical device companies that were known for their continuous improvement, such as Toyota or Shingo, and we leveraged this to develop a risk-based approach to kappa. We wrote an initial white paper, and that is where we recommended that we test the framework in a live pilot. And then to help those that had enrolled in the pilot, we created pilot playbooks, templates, and materials. And those were both for participants as well as auditors that were assessing the framework. So we put in place some data collection tools and continue to provide ongoing pilot site support in the form of bi-monthly meetings. And the next steps that we have are we will continue to collect data through July of this year. And then our learnings and the results will be captured in a white paper report that we plan for the end of December. So the last part of the slide is really dedicated to a quick snapshot of the results we've seen so far. And there's 22 sites that are enrolled in the pilot, and 16 are actively collecting, submitting data right now. And during those bi-monthly meetings, we share lessons learned, and we leverage those learnings to optimize the framework. The results we've seen so far are really quite exciting, as we're seeing improvements implemented in months versus years. And pilot sites are seeing that about 80% of their kappas can follow a fast-track kappa path. And this allows for reduced documentation and a simplified effectiveness check. And about 65% of these are being closed in less than 2 months. So I know the chart that's in here has really, really small print, but I just couldn't resist including it because the data really is quite revolutionary. As you can see on the left, the baseline data shows the time to implement improvements is over 200 days, and the whole kappa would take longer than a year on average. So you can see why employees wouldn't necessarily want to own a kappa if they're unable to implement improvements for over a year on average. So during the pilot, we've been seeing improvements implemented in 1 to 3 months, with kappas closed in an average of about 60 days. The other part that I wanted to share with everyone really is on the bottom, and this is around the fact that we developed the framework in alignment with regulations, and we really watched the audit progress. And we asked all the organizations to provide sort of a report back of that process that they had at their sites, both internal and external audits. We had about 20 different audits we've gone through with all the pilot sites so far, and there have been no findings on the framework. And the last thing I did want to note and highlight is really around the fact that the framework is encouraging improvements within the quality management system elements that are connected, like trending or risk assessments. And you can see that in the quote that I've submitted from one of the leaders at a pilot site. And she said, we're getting a better understanding of our trend thresholds and that it's really brought the risk management files to life. And this is something that we've seen echoed at the other pilot sites, that it's making the whole QMS stronger as they implement the kappa framework. So if you are interested in learning more about the framework, the MDIC website does have links to the initial white paper and some of the reasoning and the background behind the original framework that we're piloting. And it also has a link to a 30-minute training on the framework. Or you could contact MDIC or me, and we'd be happy to answer any questions you have about the kappa framework or pilot. So with that, I wanted to hand it over to Joe Sepiante, who's going to walk through the MDIC Initiative.
So within the MDIC, what is MDIC and what is the MDIC Initiative? It was something that's been launched about almost a year ago. And with the idea that because there's so much information available to us in terms of data, and something, if you look back at what we just talked about with VIP and kappa, a lot of data collection, a lot of access to data. So certainly we use data in our medical device ecosystem pretty much every day. The challenge, though, from this perspective in looking at medical device data sharing and analysis is that it's very fragmented. And like most of us who use this data, it's very reactive. So the idea here for MDIC is to get to a point where we can collect and analyze the data that could then influence decisions going forward, problem solving, so that we are much more systemic in the use of the data, the use of solutions, and work towards a much more predictive or proactive mindset when we come to solving complex issues and in preventing complex issues or challenges. Next slide. So the framework within MDIC is we have the MDIC partners, as you can see here, with the device manufacturers, providers, and FDA. Again, all customers or users of data from a variety of data sources. And it's that ability to work together and collaborate on a way to access data, analyze that data, and then drive some improvements. So that's where the MDIC framework is very important, using this frame that you see here in the center, where we're collecting the data. So we're ingesting that data, we're de-identifying that data, we're loading that information. Then through the trusted third party and MDIC, they're analyzing this data. And through that analysis of data, it then gets shared in a collective way through the MDIC outcomes session, so that we're looking at the device manufacturers, providers, and FDA who are part of this MDIC structure to then further analyze the data. So in fact, where it says systemic analysis and trends, that could actually be a cycle where the data will come out. We'll ask the third party to do a further analysis of the data and go back in through that cycle, come back out, looking for specific trends and triggers that we could then look for ways to then take on complex issues. Some of the issues that the MDIC team is looking at today includes the sources of recalls. So how much data is out there what are the sources of recalls? How do we cleanse that data? How do we analyze that data to look for any specific trends or triggers within a common area that could be causing a recall across the ecosystem? And then how could we then drive improvement looking at those triggers or common issues or common challenges? Another example that the working group is looking at is how does some of our adverse event reporting influence the decisions leading into recalls? So are there trends and triggers and signals within that data that could ultimately predict a likely recall or a possible recall? So the complexity of the MDIC work is really in the fragmentation of the data, being able to pull that data together, de-identify it, analyze it, and really draw some assumptions and even some conclusions, and developing work streams and working groups to go after these complex solutions and complex issues. The important thing here also to note is that because this is a trusted third party through the MITRE Corporation, they have a lot of experience in access to information, the use of that information outside of the medical device ecosystem. They've also done it for other businesses and industries. But the important thing here is once the data has been analyzed and we've been able to leverage the information to try to drive outcomes and improvements, that data is then purged. So that data doesn't sit somewhere forever, but it does help us guide our decisions on again, looking at ways to solve complex issues, be much more predictive. Just in reference to the kappa program, we're starting to see folks being much more proactive and preventive. And so the idea here is how do we get from a proactive, preventive to a predictive area of analysis. So a lot of great work's being done in the MDIC workspace. It's very early, but we are putting together the governance for how this team is working and doing these test cases using this MDIC model. So with that, I'm going to pass it over to Alan Baumel and Cisco for the advanced manufacturing. So Cisco, I think you're first.
Sounds good, Joe. Thank you. And I just wanted to highlight and steal from someone who we've been working with quite a bit, Ken Shinomoto, who actually was the one responsible for the slide, but I really liked it. And I thought it conveyed the message of what we're trying to do with some of the work on advanced manufacturing next. I think what you saw with regards to VIP and with even just the kappa pilot, as was mentioned beforehand, the intent there is to talk about that business process, right? To really drive that optimization and efficiency and make it more effective for the organization and more effective in achieving the outcome that is needed for patients. That gets us so far, right? And then what we're trying to do next, I think from an agency standpoint, is help be part of that solution to enable more of the technology to come into play and help drive a lot more capability and optimization in the organization and better achieve some of the goals that I think we'd like to see moving forward. So the idea there is you cannot put a technology solution over a system or a business process that's bad. It'll just make things worse. I think VIP and the work that's been done through Case for Quality gives us a mechanism to start bringing and evaluating those processes and those business practices. And now we can talk about, okay, what do we do to support that? And how do we as an agency kind of help clear paths moving forward to enable more of the technology to be adopted? And next slide, and I will turn it over to Alan to speak about some of that work.
Thank you, Cisco. I appreciate that. So to build on what Cisco was talking about, MDIC and the FDA are excited to soon be launching a new initiative that we call an Advanced Manufacturing Clearinghouse, through which we will engage with industry to demonstrate technologies focused on bringing together and enabling people, processes, and technologies. And for us, advanced manufacturing is more than just manufacturing. This effort will span the entire product life cycle. And building again on what Cisco was talking about, to help inform the Advanced Manufacturing Clearinghouse, and the scope, we are near completing an advanced manufacturing landscape analysis in which we surveyed and assessed various other industries for their use of advanced technologies, looking for ways to adopt those technologies and remove any barriers that we might have in the medical device industry. And as mentioned, the focus of this initiative is to enable people, processes, and technologies with the goals of decreasing product time to market and elevating availability, quality, and safety. We aim to do this by enabling the collection and use of data and analytics to inform risk management and risk-based decisions, facilitating design, supply, and manufacturing optimization, control, and automation, improving digital and automated controls throughout the quality management system, and providing innovation in regulatory processes, systems, and engagements, including engagements between industry and FDA. Some examples of technologies that we will be demonstrating include additive and generative part design, digital twins, for example, modeling and simulation in design and production, and digital threads, including digital design transfers, and data-driven closed-loop quality. Also included under the umbrella of advanced manufacturing is another new initiative, computer software assurance, also known as computer system validation. This has been identified as a barrier to implementing new technologies and automations for the FDA. And this initiative is all about removing those barriers. The principle behind computer software assurance is a risk-based, scaled, test-focused effort to demonstrate the intended use while decreasing the non-value add documentation burden and focusing on generating appropriate and necessary records for objective evidence. The Computer Software Assurance Alliance webpage has recently launched on the MDIC website. So please do visit the webpage for more information and to inquire on how to get involved and learn more. We are very excited to launch these initiatives and to continue expanding industry, FDA, and MDIC collaborations. Please, if you have any questions, feel free to reach out to me for information, and I would be happy to help. Thank you.
Okay, well, thanks everybody for your updates. When you take a look at this slide and we kind of bring it all together, you know, in the opening slides, we talked about MDIC and how we're very collaborative. We've got a very diverse group of stakeholders. And when you look at the work streams within Case for Quality, you see a lot of the things here. So within quality and safety, certainly most of us that have been involved in the medical device arena for a long time understand and appreciate the fact that we really are putting patients first. So it's extremely important that whatever we do, we are working towards enhancing and improving the quality of our products and the safety of those products, as well as, you know, to leading to better outcomes for the patients. But what's important also too is the data and transparency and having access to information in a way that is probably something that years ago we would never even have thought of having this access to information and being able to collaborate with the agency and our other stakeholders on that, and being very transparent with the data and the information that we have at our fingertips. You know, as I mentioned with MDIC, you know, that is going to be a transformative effort for us to be able to access data in a way that's very different than maybe we were in the past, and doing it again in a very collaborative way around common challenges and issues. So very exciting to hear and to talk about and participate in the MDIC effort when we're talking about looking at challenges within the medical device ecosystem. You know, we just heard from Alan on the Advanced Manufacturing Clearinghouse and the fact that, you know, while it is advanced manufacturing, it certainly is across the entire product life cycle, and will have influences there. the ASC, which is another effort built on the platform of the VIP program, working with sites and companies that don't necessarily meet the criteria for the VIP program because of their regulatory or compliance status, but it does give them the avenue and the access to the appraisal program, very similar to the VIP program, so that they can get on their own path of continuous improvement and working their way into that category of VIP. We just talked about the CSA and the computer software assurance guidance, and that's very exciting, and that going live, MDIC. The kappa pilot, which again, the hashtag make kappa cool. I think Catherine has done an excellent job in bringing that forward with the support of a very engaged, highly engaged pilot team, and a lot of good learnings coming out of that kappa program. And then when we talk about the quality and regulatory innovation, now we're not talking only about the processes within the quality area, but what are the regulatory challenges and opportunities within regulatory where we can innovate the way we look at products and register products and bring products to market. So when you think about MDIC and you think about the case for quality and how this all comes together, this is certainly where we are today. But as we look at other opportunities, there's a lot more to come in terms of being able to improve and, as I've always said, transform and shape the ecosystem of the medical device world, and bringing the technologies to market faster. And in some cases, what we're learning from VIP and the kappa program in a cost-effective way as well. So with that, I'd like to get to the next slide. As you've heard, there's a lot going on in MDIC. There's a lot of great things going on in case for quality and advanced manufacturing. So if any of you are interested in learning more about membership within MDIC, or any of the value-added programs that we have under MDIC, and certainly the case for quality, there's some contact information for you here. We encourage you to reach out to us, and we'll be happy to help get you involved in any one of these programs. So with that, I'd like to thank you for your time and attention, and we'll now move into the question and answer session. Before I get started, I want to thank you all for the work that you've done in Case for Quality and the work streams that you all represent, and certainly to Alan for your support in transitioning me into MDIC since February. So thank you very much. With that, I'm going to move to some questions, and some of you know who you are, so I'm going to go ahead and ask Rob and Cisco, when we talk about VIP and the program being, going from a pilot to a program, you guys talked a little bit about the results, and you talked about the working groups. So within some of those learnings and the insights, how do you see VIP influencing, perhaps case for quality going forward?
So I think part of it, Joe, is getting additional participants, scaling up the program, and seeing what we learn from that and what feedback we get. And the working groups are really designed to help us collect some of those voices in specific areas and just figure out what's next for the program. Those were all areas that we knew as we got more experience, we had an opportunity to explore and see kind of what's next and how to evolve the program. So it's really getting participation, feedback, and learning from the experiences and charting the course for the program going forward.
Yeah, I think from our standpoint, and even what we've seen up until to date, right? The VIP program provides a different degree of information, and because there is flexibility for the organization to kind of pursue what is really relevant for them in driving the improvements and driving the change, we see an opportunity and saw several opportunities to find patterns in broad activities that, I think from an agency standpoint, we can leverage and use to help, drive new programs or incentivize other activities and behaviors that we were talking about. From a collaborative community standpoint, or just CFQ as a whole, I think a lot of that general information and learning feeds into even the strategies that we take forward, right? How do we collectively decide on what the next improvement activities are? How do we shift some of the work that's being done in VIP to help target this next identified need? I see that being, and even with Medias down the road as it comes into play, this kind of self-fulfilling and self-feeding cycle moving forward, not just with what we target and do, but even what informs us as an agency and what we do.
Okay, great. And Catherine, I'll move on to the next question for you. In your update, you talked a little bit about extending the data collection through July. Does that mean that if I'm a site that's been monitoring sort of the progress of kappa, that I can still get involved, or am I, am I out? Help me understand. How can I get involved if I've been sort of on the sidelines watching the progress?
Yeah, you can definitely get involved on the working group. So you're welcome to join us. And we have a lot of discussions around common problems, obstacles, and learnings. And so you're welcome to join us there. Also, we're expecting to have the white paper done by the end of the year, so you can participate in the development of that. And you could join the pilot and get the support of the onboarding materials and begin to collect data for your site. Even if it's too late to get in the data collection for the white paper, you can benefit from the material sets and the onboarding that are a part of the program.
Okay, great. I'm going to shift gears and go to Alan now and Cisco on the Advanced Manufacturing Clearinghouse. Alan, you made a point to point out that this is more than just advanced manufacturing. It's more than manufacturing. So can you talk a little bit about, perhaps as we move towards being much more proactive and predictive, sort of an example within maybe the design space of how this touches the design space?
Absolutely, and that's an excellent question. As many of us know, in industry, if you want to develop and employ the most efficient, effective, from cost and output and quality manufacturing, it does start in design. And so design for manufacturability techniques, design, simulation, anything that we do in manufacturing that aids in the design transfer, the development of manufacturing, the execution of manufacturing. And so, one good example is digital twin, where it's a virtual modeling and simulation of the design. Can also do digital twin of manufacturing to see how that design would maybe execute in manufacturing. So it's a great point, and it's really focused on advanced technologies in the design for manufacturing perspective. I don't know, Cisco, if you want to add to that a little bit.
Yeah, I think just taking to the fundamentals of quality and quality principle as a whole, right? You're always looking to assure quality at the source, right? That's what you're always looking to get to and drive at. When we talk about that portion of, getting into that design activity and how the advanced manufacturing efforts will help in that stage, I go back to something that we started and early on Case for Quality said, right? We're always looking to see how do we drive that improvement in, control, speed, or visibility, right? And that's really what we're talking about when we talk about enabling a lot of this technology to come down to the design stage. It is more information. It is error proofing that goes on in your process. It is, speed of being able to iterate through design solutions, design changes. The connectedness that then transfers into the manufacturing activities afterwards. All of that starts in that early cycle and that early phase of the design work. And the more you do there, I think the better the outcomes are down the road and the less chance that there's an issue after the fact. And I think hopefully down the road, right, less that we as an agency have to worry about in the post kind of review activities.
So Cisco, I got a follow-up question on advanced manufacturing. From a regulatory process perspective, how does the agency view organizations that are active in the Advanced Manufacturing Initiative, and from a regulatory process and engagement perspective?
That's part of actually what we're hoping to better define and build out with the work through the clearinghouse, right? I think right now, what I could say is companies who are engaged and trying to move some of this forward on their own, we are looking at positively, right? We're trying to figure out how do we better support that piece. What the clearinghouse will let us hopefully do is try to tackle that on a broader scale. So you can collectively say, yes, this is the way to move forward, or how you're proceeding is right. Here's how you interact and engage with us. It also provides a little bit more perspective on things that we need to change internally to accommodate the implementation of different technologies of what's being done externally from an industry standpoint. So the reality is we're supportive. The catch is we don't know what we need to do to support. So this is where we start bringing all this collaboration together, start finding some of that answer solution.
Okay, great. So I'm going to shift gears back to Case for Quality for a moment. And Rob, I know you've got multiple sites within Edwards Life Sciences as part of the VIP program, and you've gone through multiple appraisals. Can you talk a little bit about how you've advanced through the appraisal process in terms of more objective evidence and things like that? You and I've talked about that in the past. Can you kind of share that for the group?
Yeah, I think, for every site we have that does their first year appraisal, we treat that more as a introductory sort of, hey, this is definitely a different process. And so we try not to do too much with that, so that the site can get used to what it's all about. But then what we found is that there's two elements that are important for us to get the most out of the appraisal. One is using objective evidence, and it's not necessarily like giving over a bunch of records like we normally think. It's we've had our appraisers attend meetings on site that demonstrate certain behaviors or processes. We give them examples of like strategic planning, or just how some of our activities at the site and those outputs align with some of the key practice areas. And by supplementing just the appraisal discussion with some of that external element, we get better feedback. Like, it closes the loop a little bit better. And then we've also had sites like my site here in Draper, Utah, where we've gone to level 3 and we've tried to include different practice areas or expand it. And so I think the thing we like about the program is that it's flexible. Sites can kind of go on that journey as they're ready. But as we expand and the more we leverage it to get the best possible feedback, the better we do as a site, because it's directionally helping us understand, where we have opportunities to make the organization perform better. Great.
Actually, I like that Rob mentioned that, because I think that's also an internal piece that we get, we struggle with, right? We're very used to the idea of collecting records and evidence coming back, and that's the evidence, but it's getting that message out. No, there is objective evidence reviewed. It is, put into practice. It's part of really determining where the state of the organization is and how to drive the best improvements. We just don't need to bring that back in and collect it as a document or a record on our end.
Okay. So Catherine, I'm going to put you on the spot for a second. When we talk about the program and the fast track, do you have an example that you could share of an internal kappa that was fast tracked, something that maybe one of our members from the pilot can share as an example?
So I think probably the key thing that you would recognize for an internal fast track kappa is really around its risk level. So if it's internal to the organization and it's not a high risk trend, they can handle it as a part of fast track. It doesn't necessarily mean that there's less rigor in the problem solving, or that it's not complicated to solve. You can actually solve complicated and simple problems through the fast track kappa process. It really is around the level of documentation that's required and the type of effectiveness check. So you can leverage a lot more of your existing measurement and monitoring as a part of your fast track kappa process versus a time-bound effectiveness check. So there's a lot of efficiencies that you can gain to allow you to solve the problems faster when it's not like when we took the data of the surveys, a majority of the organizations said 80% of their time on kappas were on documentation. Most of them are above 50%. So we're just shifting the focus from more of a documentation focused to more of the problem solving focused. So
okay. Great. So I'm going to close. We've got a couple of minutes. So I'm going to ask you guys all for your input on this final question. So as we look at the accomplishments in 2020 and the challenges that we've come through, first of all, let me thank you all for helping Case for Quality advance through 2020 as successfully as we have. High engagement, a lot of great progress. So let's put 2020 in the rearview mirror. So what are your thoughts for 2021, and what are some of your expectations for Case for Quality as we sort of go through 2021? Alan, I'll start with you.
Thank you, Joe. That's a wonderful question. I think for me, it's a little bit of what Cisco mentioned on building on a lot of the work that we've done and accomplishments, and finding those areas where expanding into new collaborations makes sense. I think advanced manufacturing and computer software assurance are both good examples of building on work that we've done in the past and doing more. And then I think finding the synergies between the programs. I know that you and I work very closely to find and kind of deepen the connections between Case for Quality, advanced manufacturing, computer software assurance, cybersecurity. So I think making sure that we stay and create connectedness between all that we're doing to collaborate on, and then finding those strategic expansions.
Great. Catherine? Thank you.
yeah, I love what Alan said, because the first thing that came to mind was the idea of, in this year, we'll be looking at gathering all this stuff that we've worked on together for the Make Kappa Cool, putting it in a white paper. But my mind is going to, where's the next place we can leverage that corporate brain power really to solve the common problems? Because when we set out to do the Kappa process improvement pilot, there's probably a part of each one of us that's like, are we doing the impossible? Like, can we really affect change in this area? And so it really is around, as we get the data and we capture all the stuff we've done so far, to me, it's just, where do we want to go next? So it's getting that understanding.
And Rob, you're next. I always like to finish with FDA, so Cisco's.
No, I think for me, it's getting back to where we're interacting a little bit more in terms of true collaboration, and I think just continuing, where we have a safe space where we can actually talk about problems and talk about from different perspectives, and agree on common areas where we can make progress on solutions that help everybody succeed. Because what I continue to remind myself is, we all really have the same mission. We're all really trying for the same thing. And so the more we focus on, safe and effective procedures that are consistently delivered by medical professionals, there's a lot of common areas where we can make improvements and change things. And our ability to do that, we've already seen it. And so I'm just looking forward to more continued success there.
Great. And Cisco.
Yeah, that's interesting. I'm actually not going to speak in terms of what I'm looking to see, because I think Catherine said something there that really hit spot on. Ever since we started this program and this collaborative activity, I have been shocked, and my expectations have been exceeded with the solutions that have been brought to the table to address some of the some of the direction that we can go, right? The idea of moving from, I remember in the very beginning of Case for Quality, where everybody was asking, well, what does the agency want? To now people bringing us like new ideas, saying, hey, we could possibly do this. And, I think this would help drive this type of thing. And some of them are, just completely phenomenal approaches that we should be pursuing and we should be considering in some way, shape, or form. So I just like the idea of continuing seeing some of that. So I'm kind of eager to see what comes up in 2021 and 2022 moving forward.
Terrific. Well, thank you. All right. Well, you guys, again, I appreciate all of the work and support on Case for Quality, and certainly the collaborative community and all the work streams. Thank you for your time today. And I think we'll end the session here. But again, have a good rest of the day, and thank you all for being part of this.
Thanks, Joe.
Thank you, Joe.